everyone, we are Group 14, and we would like to talk about Alzheimer's disease. Because of aging population, Alzheimer's disease becomes more popular in Hong Kong. As a healthcare professional, we hope to explore more on elderly health. Therefore, we have chosen this as our topic. According to the World Health Organization, Alzheimer's disease, AD, a progressive, irreversible chronic neurodegenerative disorder, is a common form of dementia. About 6 to 7 people in 10 with dementia in the world suffer from it. It is most commonly diagnosed in age over 65. The scientists are still investigating the cause and radical cure of AD, but we know that this disease brings damage to brain cells and causes problems of memory, thinking, and behavior. And the most common symptom discovered in early stage would be loss in short-term memory. However, don't mix up with memory loss in normal aging process. If we have AD, we forget something and then we cannot get that information back. It doesn't seem familiar to us even if someone reminds us. In 2010, there were about 0.09 million Hong Kong people living in the community suffered from dementia. And the number of affected people is doubled every 20 years. It is estimated that in 2036, there would be over 0.23 million people in Hong Kong suffered from dementia. It means that about 0.03 million Hong Kongers will have AD in 2036. And for diagnosis, we can diagnose AD by brain scan, including CT, MRI, medication review, MMSE, and behavioral observation. Although we don't know the exact cause of AD, the scientists have figured out some risk factors of AD. For genetic factors such as mutation, female gender, physical aspects like head injury, old age, medical condition or disease, for example, obesity, high blood pressure, high blood cholesterol level, depression, lifestyle aspect like alcohol abuse, smoking, physical inactivity, poor diet, a low educational level, and some environmental aspect like exploring the chemical substance like aluminium, zinc, or suffered from some foodborne disease or have been infected by viruses.
Alzheimer's disease is closely related to neuroscience, and it involves several neurotransmitters, including acetylcholine, glutamate, serotonin, norepinephrine, and dopamine. In the brain, neurons are connect and communicate at synapse, where tiny burst chemicals called neurotransmitters carry information from one cell to another. Alzheimer's will disrupt this process, damaging the synapse and kill neurons. And finally, the brain communication network is being damaged. Besides, neuron is also the chief cell to be destroyed. For the pathogenesis of AD, increased neuronal production of beta-amyloid, decreased activity of beta-amyloid degrading enzyme, and alteration in transport process that straddle the beta-amyloid across the blood-brain barrier will contribute to the aggregation and accumulation of beta-amyloid. Besides, beta-amyloid oligomers will impair the synaptic functions. The fibular amyloid platelets will disrupt and displace the neuronal process. Lastly, the abnormal vascular will impair the supply of nutrients and removal of metabolic byproducts. And finally, it will cause the microinfarcts and promotes the activations of astrocytes and microglia.
The Alzheimer's disease will cause structural and functional changes. The Alzheimer's disease, there are significant changes in the axon, and the axon is composed of microtubules, which is stabilized by the tau protein. For the AD cases, there will be detachment of tau protein, and which forms the filaments in the neurons. Neurons will then be degenerated and lost their connection. Amyloids are the protein fragment that's normally produced by the body, which is the slices of the amyloid precursor protein, also known as the APP. Alpha secretase leads APP to amyloid, which enables the body to the protein to be easily eliminated as the waste product. For the AD cases, the alpha secretase are less active, and the beta and gamma secretase will be produced. The amyloid fragment, beta amyloid, which are the protein fragments snipped from the amyloid precursor protein, will normally be eliminated. But in the AD cases, it will accumulate, form hard and insoluble plaques in the spaces between the nerve cells. And the plaques are made up of cellular waste, amyloid, and cytokines. And in the and he comes to the tangles. The tangles build up in the cells, which is the twisted fiber of tau proteins, and it will forms a part of microtubules, and normally it helps to transport nutrients and important substance from one neurons to another nerves. And in the AD cases, the tangles will collapse, and so there will be no nutrient transport to the neurons, and the neurons will die and outlast atrophy of the brain. Plaques and tangles are the prime suspects in damaging and killing the nerve cells. There are other structural changes in the which is the hippocampus and the connected structure and its connected structures. Cerebral cortex will get thinner and the brain will eventually shrink. The ventricle will grow larger, which is very significant. We can see from these pictures. And here comes to the functional changes. The cognitive functions such as orientation, memory function will be problems. Since Alzheimer's disease will affect the hippocampus, the formation of short-term memory will be very difficult, and also the retrieval of long-term memory is also very problematic. There will be changes in the frontal lobe. The function of frontal lobe are logical thinking, program the movements, and some complex planning, such as learning, driving, cooking. The shrinkage of the frontal lobe will decrease the motor coordination. And for the prefrontal lobe, there will also be a very significant effect on it, since prefrontal lobe makes up the individual personality and determine motivation in individual judgment, and shrinkage in this area will decline once judgment lower its motivation, and the person may withdraw from the social activities.
Here comes to the progress of disease. Alzheimer's disease is a progressively deteriorative disease, which means that the structure and the chemistry of the brain becomes increasingly damaged over time. Most patients live 4 to 8 years after diagnosis, and it is mainly classified into 3 stages, including the mild, moderate, and the severe stage by the patient's abilities and symptoms, according to the Alzheimer's associations. Mild stage is also called the early stage, and patients show the early symptom of AD. They are normal in activities of daily living, ADL, and function independently. They may have memory lapses such as forgetting familiar words, location, and names. They are harder in performing tasks in social and work setting. They may also forgetting material that he or she had just read, misplacing objects, and increasing difficulties in planning and organizing. When the Alzheimer's disease develops, it comes to the moderate stage. It's also called the middle stage. They will start confusing words and have emotional problems like frustration, anger, feeling moody, and withdrawal. They will act in an unexpected way, have difficulties in performing ADL, expressing thoughts. They may also unable to recall personal information such as phone numbers and address. They may have decreased orientation function, may confuse where and when they are, and difficulty in choosing appropriate clothes for the right season or the occasion. They may have the incontinence problem. They may change of sleeping pattern and have higher risk of wandering and becoming lost. Also, they may have personality and behavior change. Lastly, it comes to the severe or the late stage. They require fully personal care assistance in ADL, lost awareness of recent experience and of their surrounding. They may change in physical abilities such as walking, sitting, and swallowing. They may have difficulties in communication and vulnerable to infection, especially pneumonia, according to the Alzheimer's associations.
Based on the progress and characteristic of the disease, nowadays there are two types of treatments: non-drug approaches and medications. For non-drug approaches, it can be used to treat some adverse behavioral symptoms and deal with sleep changes. By managing behavior symptoms, it promotes physical and emotional comfort of the client while making changes on stimulus that affecting sleeping. It can improve sleep routine, sleep environment, and reduce daytime napping. About medications for Alzheimer's disease, for drugs currently used, there are a few of them. For example, cholinesterase inhibitors and memantine. It helps lessen and stabilize the cognitive symptoms while can treat memory loss. To treat behavioral symptoms, antidepressants, anxiolytics, and antipsychotics also help to address problems like irritability, anxiety, and hallucination. Also, there are medications like tricyclic antidepressants and benzodiazepines that also help to cope with sleep change. Currently, the healthcare professionals usually suggest the following preventions. Participation in cognitive leisure activities can increase cognitive reserve and thus to reduce the risk of getting dementia. Also, patients need to be aware of vascular disease and make preventions and receive treatments. For the current research development, there are some treatments that can help to maintain the cognitive abilities or control desirable behaviors of the patient. Some organizations are doing research on tissue changes that may enable new treatments. For example, manipulated protein may reduce tissue pathology of AD. Antihypertensive medication may be effective to have a direct effect on receptors in the brain tissue or affect the flow of the brain. Lastly, determine the target genes that can be manipulated may be one of the best methods to treat the disease. Drugs is another useful tool in the future. Under current investigation, some drugs are tested to be used to reduce the symptoms of the disease. For example, the API trial is studying a drug called crenizumab, an immune-based therapy which delivers antibodies against beta amyloid in an effort to reduce the negative effects of excess beta amyloid so as to delay the gene mutation. Gantenerumab is another drug that can slow down or stop brain changes and prevent symptoms of occurring. In the future, AD may become a fully preventable disease. There are already some research carrying out. For example, since high levels of beta amyloid in the brain increase the risk of developing AD, a research called APRIL trial is studying the effectiveness of solanezumab, a drug targeting beta amyloid, which can help prevent the cognitive decline of this devastating and ultimately fatal disease. The Tomorrow trial is exploring whether the anti-diabetes drug pioglitazone, which increases the brain's ability to use glucose to fuel nerve cells and can prevent mild cognitive impairment due to Alzheimer's disease. And the most common research on prevention is about treating the mutation genes that cause AD.
All in all, Alzheimer's disease affected the daily routine and social activity of the patient. If in the future, researchers can find out the treatment and prevention of this disease, it will be a benefit for the society. And on the other hand, by doing this project, we understand deeply about the progress, pathology, and neuroscience of Alzheimer's disease, which gives us a chance to be more familiar with this popular aging disease. The knowledge learned during this project would be useful in the future for our OT practice. Thank you.